Welcome back to WBS Management Consultant. Today we're breaking down a real feasibility study, a project that's solving two problems at once in Dubai: profit and social impact in a single development.
The proposed Addiction Rehabilitation Center in Dubai, based on a two-segment model, is both socially impactful and financially viable. Doctor. Addiction in the UAE spans substance abuse, alcohol, opioids, prescription drugs, debt, and behavioral addictions.
Hello, everyone. Good. So, the first of all, today, we have the topic of addiction rehabilitation project. Fine, because this kind of the project in UAE, it's a new. Fine. So it means you will not see, or you will never see such kind of the project, because that would be the first time. We have provided the feasibility study to one of our client who want to start this kind of project in UAE, and they are more interested to start and explain to their investor as well. So I want to just highlight few things, and probably you will get the better idea that how it will move on. This kind of project can be done with the help of the government or some kind of regulatory authorities, where you would have better, the understanding and the cooperation, because it will help and boost, grow the economy in a very healthy way. Fine. So these kind of things would be better for the better economy, and definitely you will get the most out of it. Fine. So let's discuss, and I will share the information, then we can move on. Fine. Let me share the screen with you, and thereafter that we can move on. Fine. So this is the, you can say this, it will give you the feasibility study, that how it will look like. Okay, what are the components, as I mentioned, what are the projects detail, how it move on, how we'll calculate. Okay, so all these things we will discuss. Fine. So first of all, okay, now fine, this would be the first one. Okay, so feasibility study. Okay, so addiction project. So it means that would be, if you'll start in UAE, so for sure it would be in its own nature, that would be the first one. Fine. The feasibility study evaluates the establishment of a specialized addiction rehabilitation center in Dubai, offers comprehensive treatment for the substance and behavioral addiction as well. The proposal, definitely you can get the stats, how it move on. The proposed project has follows the two-tier model. If you will get, for sure, we can explain to you the segment 1 and segment 2. Segment 1 is the public. Definitely it would be interaction with the government authorities. The segment 2, it would be a private. Fine. You can carry on both of these. Fine. So if we'll go for the public, or social impact model, so 50-bed rehabilitation center, institutional building, okay, where you need to get in rent. Okay, so, or might be your own building as well, depends. Fine, how you will move on, how you will see. Okay, so sorry for that, my cursor is not working properly. So, okay, so former school or unused government assets as well, it could be. Fine. So affordable 60-day addiction treatment packages, it would be largely funded by the community donation, CSR contribution, and government or NGO grants. So this would be, as I mentioned to you, the segment 2, private or premium model. Okay, so 12 premium villas with a total of 48 beds. 12 premium villas. Fine. High-end confidential, the 60-day rehabilitation center and the wellness program for the high net worth and upper middle class income clients as well. Fine. So self-pay or insured with the significantly higher daily tariff as well. Okay. So it will provide, what it will provide, the center will offer evidence-based clinical program, including the medical detox, psychiatrist, and psychological treatment, group therapy, family counseling, relapse prevention, and holistic wellness, fitness, mindfulness, vocational, and reintegration support as well. So the total investment is required for this project. How much? It would be 38 to 40 million, including fit out, medical equipment, vehicles, and initial working capital for both segments. For sure, for the public, it would be less, but for the premium, it would more capex required. The final financial projection, if I'll give you the overall estimate, it will how it will be. So you can see over here. Okay, so you can see how it will look like. The revenue growth from 1 year to 5 years, 17% CAGR, compound annual growth rate, and reaching to 157 million by year 5. Overall EBITDA margin improving from you can say 12% in year 1 to 29% year 5. Strong financial viability, especially driven by the private segment too, as I mentioned. Definitely, the segment 1 would be the more with the government department, because you can classify the segment 1 is public and segment 2 is the private. So is operated on a social non-profit basis, but supported by the grants and donations. Fine.
Let's look at why this project matters in the first place. Before we go further, let me explain this two-tip model in the simplest way.
Next thing is that the project background and rationale. The project background and rationale. Okay, what would be? Addiction in the UAE spans substance abuse, alcohol, opiates, prescription drugs, and behavioral addiction, gambling, gaming, internet. There is a shortage of the accessible and affordable rehabilitation center, especially for the low-income residents and expatriates. Stigma, limited bed capacity, and high treatment cost creates a treatment gap, leading to underdiagnosed and untreated addiction as well. The proposed center aims to, what it will provide. Fine. You need to see this one. Okay. So provide clinical robust and confidential treatment, offer affordable access segment 1 through cross subsidy and donations, create a financially sustainable private model. Okay, segment 2 to ensure the long-term viability, align with the UAE public health agenda, CSR initiative, and community development program. Fine. Now let's talk.
So who exactly is this bridge built for? Now explain market and demand analysis.
Talk about the market analysis, how the market is considering such kind of project in UAE, how it is moving, what are the demand, what are the problem and the challenges as well. So if you see the target market, segment 1, public or social patients, UAE national and residents from the low and middle class segments. Fine. So it will come the referred by the government entities, law enforcement, diversion program, hospital, social services, NGO, and community organization as well. Segment 2, private premium patients. Okay, HNW, high net worth. Okay, individual. Okay, and affluent individuals in Dubai, UAE, and wider GCC, needing confidential, high quality rehabilitation, corporate executive, business owners, professional, dependent of affluent families. Fine. International medical tourism patients seeking treatment in Dubai. Fine. What are the demand drivers? Okay, raising the awareness of the mental health and addiction, increasing stress, lifestyle issues, and behavioral addiction. Government focus on public health, community safety, and rehabilitation instead of punishment. Limited number of holistic or specialized rehabilitation facilities with both medical and psychological component. This is very important. Now, what would be the competition in the market? How we can tackle a small number of the a small number of rehabilitation units. Okay, you can see over here in government and private hospitals, some outpatient psychiatrist clinics and counseling center are available, but limited number of the residential structured 60-day program. Opportunity to differentiate what you will get, because if you will make it like this. So dual tier model, social plus premium, international standard protocol, outcome tracking, relapse prevention, follow-up, family and post-care program as well. Fine.
Now here's how this actually gets delivered on the ground.
Social model and the program design, how the service model and the program design, how the service model look like, mean business model, and how you will design it so that the people, they will get the benefit. Okay, so what would be your core services? Okay, so medical detoxification, inpatient rehabilitation 60-day program, including what they will provide, psychiatrist assessment. Okay, so individual psychology, group therapy, family counseling, psycho education, or fitness, yoga, mindfulness, and spiritual and emotional well-being programs, post-discharge aftercare, fine, outpatient follow-up support groups, fine, referral clients network, and with the corporation and hospital and the community center as well. Now let's talk about, because this one we have given the core services, what you can introduce in your addiction rehabilitation center. Now let's talk about the business model. Two segment model would be, the first one, it would be, let me give you the idea how you can move on. Public and definitely the private. Fine. In the public model, you will go in the 50 beds in a repurposed institutional building, old school or unused government facility, average 60-day stay, 6 cycles per bed per year, 18,000 bed days total per year. So target utilization ramp up from 50% in year 1 to 95% in year 5. Okay, so nominal tariff of 1,500 per night, but funded largely by the government grants, licensed fundraising campaign, CSR donation, and NGOs. If you go for private, definitely. So 12 villas each with the 4 bed, 48 beds. Same 60-day cycle. Okay, 6 cycles per year. Once 17,280 bed days per year at full utilization. Okay, utilization expected to increase 50% in year 1, 95% year 5. Tariff approximately, okay, so tariff approximately 8,000 per night per patient. This is the main difference, because here you can see 1,500 and here you can see 8,000. This is the main difference. Fine.
Now here's how this actually gets delivered on the ground.
Now, technical and operational feasibility, how it move on, what are the technicalities, and how you make it operational. Location and facilities, that would be, the location is Dubai. Okay. So central position in UAE and connectivity to GCC, strong healthcare infrastructure and regulatory framework, attractive destination for international patients. Fine, it should be. If you will provide these kind of facilities for the people, they will come outside of the UAE as well. Segment 1 facility, approximately 50 beds, as we mentioned. Okay, conversion of the unused government or building, old school, into male and female inpatient wards, consultation room, therapy rooms, group session halls, pharmacy and medical treatment rooms, laboratories or contracts with external labs. Okay, so dining, recreational and outdoor areas, administrative, security and support services as well. Okay, now let's go to the segment 2, villas. Okay, where it would be a private. So 12 units mean 12 villas, 4 beds per villa. Fine. So 48 beds. Fine. The above one would be the 50 beds. Okay, this is the main difference. So premium residential environment with the private or semi-private rooms, individual therapy and consultation rooms in each villa on a main campus, spa, fitness and wellness amenities, high privacy, luxury finishes, or consideration level services. Hopefully it will give you the clarity. Now the human resource come, that who will be the staff, how to manage, what kind of the level of the staff, how you will manage this project. Fine. So let me explain to you the indicative staffing for each segment include medical and clinical staff, general practitioner, psychiatrist, psychologist, internal medicine specialist, social worker, okay, registered nurses, sport and advanced security staff, administrative and finance staff, housekeeping and catering, either in-house or out, whatever you will do. Okay, how you will arrange this one? Okay, so staff numbers scaled up as a bed occupancy increases. Fine. Starting around 3 GPs, 2 psychiatrists, 2 psychologists, 2 internal medicine doctors, 4 social workers, 40 nurses, 5 securities, okay, 5 admin in year 1 for each segment and increasing progressively. Fine. Now the next thing is come the licensing and regulatory requirements. Okay, so how you will apply, to whom you will apply, how it will be. Okay, so the first department would be DHA. Okay, so you will approach to DHA with your all requirement. My cursor has been unselected. Sorry for that. So DHA, okay, or relevant emirate authority for the inpatient rehabilitation hospital or center, pharmacy and controlled substance management, clinical staff credentialing, okay, compliance with UAE narcotics and psychiatrist, physio, physiotropic regulation, health and safety, fire safety, and building codes on whatever is there. Fine. Now we'll talk about the regulation and legal and institutional structure. Project sponsor, who will be operator? The Time Vision Institute, okay, or similar SPVs, okay, special purpose vehicle to manage both the segment. TVI act as an administrator of initiative, earning administrative, if who will manage 10% of the revenue to cover the corporate overheads, management, fundraising, and governance. Formal MOU agreements, because somebody else will come to manage this project. If you can all manage, no need for this one. Government entities for building use referrals. Okay, referrals would be there. Building use referrals possible. Okay, licensed NGO for fundraising campaigns, CSR, insurance companies, corporate clients for private segment referrals as well. Okay, marketing and business development strategy. Fine. Marketing and business development strategy. Okay, marketing and business strategy, segment 1. Okay, and segment 2. Okay, collaboration with. Okay, so next is collaboration with ministers. Okay, so public hospitals, courts, police, social services, NGO, community organization, and school universities awareness campaigns as well, because it will be very helpful. Fundraising and CSR campaigns, online donation platform, SMS fundraising after approval, corporate payroll giving program, and CSR sponsorship, tax deductible donations for UAE registered companies in line with the Ministry of Finance regulation as applicable. Fine. If we'll go for the segment 2, discrete or brand driven marketing, focusing on referral from psychiatrists, physician, and international clients, partnership with the corporations for executive health program, medical tourism agencies, and international insurers as well. Fine. Strong online presence, emphasizing the confidentiality, premium environment, and outcomes. Brand positioning. Okay, so brand positioning. You can make your brand as well. Financial.
Now here's how this actually gets delivered on the ground.
Feasibility. Okay, so it's just an estimate that how the figures will come up. Okay, so all figure approximated based on the financial model in the uploaded document they can. Okay, revenue projection, all segment combined, year 1, year 2, year 3, year 4, year 5. Breakdown year 1 versus year 5. You can see the public segment to private segment from year 1 to year 5. Fine. How it move on. So revenue growth for over year 5, as I mentioned, it's a 17%, which is very good. Okay, profitability. Gross profit grows from 54.9 million to gross profit 114 million. Fine. Likewise, the gross profit margin 66 to 72%, which is very, very good. Okay. EBITDA would be 12% in year 1. Okay. And 29% in year 5. Public segment remains structurally loss-making, EBITDA negative, as it's linked with the government. Fine. But in segment 2, you will get more profit, and then it will be compensated against 1. So cost structure. Now I'll talk about the cost structure. Key operating cost include staff cost, doctor, nurses, therapists, social workers, support staff, medical consumables. Fine. Medical consumables. Okay, so approximately 4 to 5 or 7% revenue depending on year and segment. Operating expenses, utilities, food, laundry, maintenance, security, 30 to 40% of the revenue. Okay. Revenue declining as a percentage with the scale. Okay, admin expenses 10% of revenue. Okay, so rent. Segment 1, public building. Okay, 2 million, 0.2 million per year. And segment 2 to 12 villas, 3.2 million per year. If we are estimating, because we have some kind of estimate that I will move on. Depreciation is assumed to be 5% revenue. Okay, so capital investment and funding requirement. If you'll go for the first year, rent 0.2 million, as I mentioned. Okay. And first year for the private segment, 3.2 million, 12 villas. So capex is fit out equipment, 8.7 million. Working capital is for first 6 months, 5.9 million. So the total funding requirement is 14.8 million. But if you go in the segment 2, 12 million for capex, ambulance is for 3 million, 0.3 million, working capital for fiscal 8.5, and then the capital funding you require 23.6 million. Fine. So the total project, it will cost you 38.4 million for both. Fine. Funding can be structured through the equity for the long-term loan or the grants, whatever you think best. Fine. What would be social impact? Provided the structure long-term rehabilitation for 100 of the patients per year who otherwise might not get access to the treatment, and all these detail what would be social impact as well. Okay, so risk analysis and mitigation, you can see. Okay, what would be the risk, what are the description, and then mitigation mean how to handle the risk as well. So regulatory risk, you will find the regulatory risk as well. So next is regulatory licensing risk, delay in approval for rehabilitation facility, use of government building, controlled drug handling. Funding risk, definitely difficulty in raising full 38 to 40 million or sustaining donation for segment 1. Utilization risk, lower than expected bed occupancy in the initial year. And then the you can see, okay, staffing and quality of quality of the staff, shortage of the qualified psychiatrist and the clinical staff, quality concern, reputation and confidentiality, any breach of the privacy or negative patient outcome. Conclusion, what would be your conclusion? Okay, so my conclusion, the proposed Addiction Rehabilitation Center in Dubai based on 2-segment model is both socially impactful and financially viable. Fine. Public segment fulfill the critical community and government need by providing affordable structured treatment supported by donations and grants. Private segment offer a premium high margin service that sustain overall profitability and allows the continuous reinvestment in quality concern. For both the segment, you need 38 to 40 million on average. Fine. So the next thing is that because I was talking about more and more bed days, 18,000 bed days, how it has been computed, I will give you the idea. So as I mentioned in segment 1, 18,000 days, okay, segment 1. So if we will make it simplify, okay, so if one patient, okay, stays for 60 days, fine, one patient stays for 60 days, and one full treatment cycle would be 60 days. Okay, how many cycle fit into 1 year? Definitely 60 divided by 360 divided by 60. So you will get how many cycles? 6 cycles. Fine. So in that way, you will get the better idea. So 6 cycles per year. Okay, so each bed can treat around 6 different patients in 1 year. If it is 6 cycle, so 6 patients you can handle. Each bed can treat around 6 different beds in 1 year. I'm talking about one each bed. So multiply how many beds? 50. So how many beds would be? 3,000, 300. So multiply by, you can multiply with the number of days as well. Okay, so if the rehabilitation center 50 beds for the segment 1, fine. So each bed 6 cycles patients per year, each cycle 60 days, total bed days, number of beds 50, cycle 6, and days per cycle is 60 days. So total it would be how many? 18 days, bed days per year. Fine. Next is so how it has been computed. That's to make you clarity. Fine. As I mentioned over here. So it's very simple that 1 year 60 days, one patient stays 60 days, and so each bed can be used for 6 times per year. So with 50 beds, you would have 300 patients into 6 days, 60 days each, 18,000 beds. If we'll talk about the 17,280, the same calculation, it means this is for the private segment. Okay. So if we'll go in the private segment, 12 villas, each villa has 4 beds, so 48 beds. 48 beds. Okay, so multiply by, okay, how you will compute this one? So the same thing you will apply for the 48 beds as well. So 48 beds, 6 cycles, 60 days. So it will become total how many? 17,280. Fine. So this is the calculation for this one. Okay. So I have made you a simple calculation. 48, 28, 288 patients per year, and multiply this one. So it will become this one, because I made it very, easy calculation for you so that you can get the better idea. Fine. So that's it. Okay. So I have made it a little bit clear for you. Okay, if you got the complete idea that how the rehabilitation feasibility study for the center, for the public and private both, how it can be built, what are the components, how it would the cost. So I just given you the approximation that how it will be, and in that way you will get the better idea. So thanks for watching. So we will see another feasibility for another project with a different industry. Thank you very much.
Thanks for watching. If you found this breakdown helpful, don't forget to like, share, and subscribe for more feasibility studies and project insights.